Hi, good people. I hope you are well. Today we are looking at a test for certified nurse assistants or even nurse aides, and we are looking at test examination practice theory test. So we are just looking at the questions, then we also give you the answers. If there is any other thing, you can just post it down the chat box and we'll try to answer. For those that are new to the channel, we kindly urge you to give us a subscription if this information is beautiful or is impactful to you. Like our videos, comment and share to others. Let the channel go viral. Thank you for watching. Let's continue. The first question reads about when assisting a client in learning to use a walker, it's important to do we stand behind him and use a transfer belt, put padding all the way around the top rim, let him walk by himself so he gains independence. Let him practice using the walker on the day he is being discharged. So our question, we're just focusing on the certified nurse aides or nurse assistants. So how do we assist clients who want to learn how to use a walker? What do we tell them? That's what the question is really trying to ask us for today. So we ought always to do the answer is option A. And let's just give you an explanation behind this question. So when we are assisting these clients who want to learn or who are learning to use the walker, we're always supposed to stand behind him and when we use the transfer belt, because now we are moving them from the bed to the walker. Okay, so we stand behind him, then we use the transfer belt. Then you need also to know when we stand behind him and we use the transfer belt, why should we do this? We are trying to protect both the client and the nurse aide, the certified nurse aide. Okay, so you as the certified nurse aide, you, apart from also protecting the client, you ought to protect yourself. Okay, so stand behind him, then use the transfer belt. Protection plays an important role there. Okay, next reads about urinary retention refers to. So throughout our discussion, you will also know that ideally for nurse aides, you need also to have a clue of these medical terms. So when you talk of urinary retention, so we are focusing on the issues with the bladder, the kidney. Okay, retention, what is retention? It means something to be retained. It's something to, it's not flowing, it has retained, it has stopped. Okay, so what does it refers to? Is a normal output of the urine. Of course, if you say retention, it's not moving properly. Okay, inability to urinate. At this point, you can also think of that as urinary retention. Incontinence. Now for incontinence, it's like it's leaking by itself. It's leaking. But retention, it's not moving. A large output of urine, no, it's not that. So we are key to go with option B as our answer, which is inability to urinate. So you to know that for urinary retention, we've just said is always an inability to urinate. And retention of the urine is a symptom that should be reported to the charge nurse as soon as it's reported. Why are we reporting? Because ideally we are supposed always to always be releasing our urine. Why? Because the kidney helps in detoxification, filtering the blood. So as it filters its blood, it's also removing the waste product, all the things that are not needed by the body, they're always released through the urine. So once a person is having a retention, it means this person has an inability to pass the urine. We're always at risk of so many things. So as soon as you note that a client is not able to pass the urine, so you report it to your charge nurse, the nurse that is in charge of you, for him or her now to take further actions. Okay, that's something about urinary retention. 3 talks of normal hearing loss in aging is usually related to the ability to hear. So this question now brings us back to geriatrics. Geriatrics, mainly we are just focusing on the elderly or the aged. So as we continue on aging, we always at risk. Even our organs are already overworked. they have really worked. Some of them are really shutting down. Apart from that, also exposure to most of these things, the harmful toxins, the chemicals, how the environment is. We're having too much stressors. So you'll always find that when one is aging up, some of the organs starts shutting down. That's why we are talking of this normal hearing loss. Okay, so the question is trying now to ask us, how does the normal hearing loss come about? So it reads about normal hearing loss in aging is usually related to the ability to hear. Okay, so you always have to have a clue about this. So we go with answer A, which is always high-pitched sound. So you'll always find most of them, they hear more the high-pitched sounds. Okay, and the reason behind it, we need to know that because of this aspect of hearing loss, the aged hear well if you lower your voice. So shouting in high-pitched voice does not help. So as people try to advance, then they have the normal hearing loss. If it's normal hearing loss related to aging process, you'll always find they have a problem. They can't hear high-pitched sound. But if you talk to them with a lower voice, they hear you more. Okay, so if you try to shout, you are not helping them at all. They won't hear because they have lost that aspect of hearing high-pitched voices, which will not help at this point. So that's about the hearing loss as we relate it to the process of aging. Next reads about the best way to safely identify your patient is. So this is always part of identification. It's always a key thing as a certified nurse assistant or nurse aide, because you might find you are doing an intervention. Yes, you are doing the right intervention, but to a wrong patient, which will really affect or even will make the prognosis to be poorer. So you'll find you are not helping, but you are mainly damaging. So we ought to always do the proper identification of the right patient, then we do the procedure. So the question talks about the best way to safely identify your patient is. How do we identify our patient? Do we ask his name? Do we call his name? Okay, and waiting for his response? Do we check the bed plate, or do we check the name tag? Asking his name, probably, you'll always find different types of patients. And also apart from that, also there's something we talk of conscious. The others will be semi-conscious. Apart from that, you also have some other aspect of orientation. You'll find some patients are not oriented to self. You'll ask them, what's your name? They will tell you, I'm called Peter, and they're not called Peter, they are called probably Silas. Okay, so asking their name at this point is not that much effective, because you'll find the others who are not well oriented. So you'll always find you want to do something, you have been asked by the charge nurse that go and take this patient from this place to this other place, go and take Peter from this place to this place. Then you go and ask a patient who is not oriented to self, then he says it's called Peter. Now you'll find you are moving this patient, probably the patient had like spinal injury, is not supposed to be moved. So you'll find you are making more harm. So asking the question will not really be well. Calling his name and waiting for his response. Probably you're handling the geriatrics, those people who have advanced in age. And we've also talked of the normal. In the previous question, we've just talked of the normal hearing loss. Probably this patient has hearing loss. The patient did not hear you well, and probably he or she responded, and you go check the patient, you go do the intervention, and that's the wrong patient. So we don't call his name. Okay, by checking the bed plate, of course that will really help, because in most hospitals you always find a patient is always assigned his or her own bed, but it also depends. You might find the patient has just moved from his bed to other person's bed without you knowing. Then you'll come check the bed plate, do your intervention, then you'll find you are worsening the condition. So we always need to check the name tag, because you'll always find most patients, every patient has his or her own name tag, and that will really help. Okay, so so as the way just we've explained, we've said we go with option D. Okay, we've always said that a confused patient may answer to any name or even lie down in any bed. Okay, Or you'll also go to facilities where we have more patients than the number of beds. You'll find that others are sharing beds. So relying on the bed plate will not be practical at this point. So you ought always to check the name tag. Number 5 reads about Miss John is on a bowel and a bladder training program. She has not had a bowel movement for 3 days. What should the nurse aide do? So another tip for you guys, you ought always to have the knowledge. This person has not have any bowel movement for 3 days. Bowel movements, ideally, we're just looking at peristalsis. Peristalsis, it's there. We are having the bowel movement. It means this person will always go to the toilet. But she has not had any bowel movement for the past 3 days. What should you do? Will you report to the charge nurse? Will you give enema to the client? Will you over prune juice? Or will you increase the fluids? So if you try check this question, when one has not had any bowel movement for the past 3 days, we are thinking of many things. Okay, it might be constipation, it might be fecal impaction, it might be many things. So you as a certified nurse aide at this point, you are not supposed to do any other thing, but you're supposed always to report to the charge nurse. Because why? This thing is not normal. Okay, so as we'll be answering this question as the certified nursing aides, we'll always go with you're supposed always to report to the charge nurse. Okay, then the nurse will see what to do next. Okay, so you ought always to report to the charge nurse. Okay, so the answer reads about option A, of which we've just said. Then the nurse aide should report to the charge nurse. Okay, then why? Because nurse aides cannot order a procedure or even increase the fluids. Okay, anything unusual must be reported to the charge nurse. That's something that you ought to know. 6 reads about the proper medical abbreviation for before meals is. Before meals, do we do PC? Do we do BID, SC, or TID? So for PC is always after. BID or BD, it means twice a day. Then SC, it's always before. Okay, then TID, that means thrice, 3 times a day. So every 8 hours, or TDS. Okay, so we go with the option C, SC. Before meals, AC. After meals, PC. Okay, yeah. 7 reads about the proper medical term for high blood pressure is. High blood pressure. What is high blood pressure? We talk of hyper. It's hyper something, hypertension. Hypo means it's low. Hyper, it's high. Okay. Diabetes, it's always a problem with the sugars. But I'll just try give you the definition of diabetes. It's always a chronic metabolic disorder. It's mainly characterized by sustained elevated blood glucose levels, and all this is always attributed to either insulin action, release, or even both. Okay, so it's a chronic metabolic disorder. So we're having sustained blood glucose levels. That's about diabetes. Severe, it's always cerebrovascular accident. So the proper medical term for high BPs will go for hypertension. Okay. Then the last question reads about a patient who has difficulty chewing or swallowing will need what type of diet? So if I have a problem with chewing, swallowing, will you give me clear liquid? Will you give me low residue? Will you give me bland? Or will you give me mechanical soft? Let's try and brainstorm. What sort of diet will you give this client? And remember, the client has difficulty chewing or even swallowing. Okay, so we are supposed to give option D, which is mechanical soft. What's the reason behind it? A mechanical soft diet is easy to chew, swallow, and even digest. Okay, because the question was talking about difficulty chewing and even swallowing. Okay, so we go for mechanical diet. So up to that point, we are done with our paper, which we've looked at the key questions that you might be asked We've also given the rationale, and we've had a detailed discussion about this. So if the video is helpful to you, you can give us a subscription. You can like this video and share to others. Why don't you also give us a comment? Do you have any other question that bothers you? Then we can try to tackle it. Thanks for watching. Bye bye.